got our lovely patient here all ready for treatment, and what we have done already is we have done our 1-minute pre-treatment wipe where we've cleaned and prepped the skin. We've marked the areas that we're going to treat today, which is her abdomen, and so now we're all ready to place the applicator. CoolSculpting is a nice treatment for fat reduction, and it's non-invasive. There's no downtime. So that's a big bonus for a lot of us with our busy lives and schedules. So I'll get this treatment placed, and then we can talk a little bit more about CoolSculpting and how it works. Prep the skin, and now we're ready to place the gel pad. So this is another layer helping to protect the skin and also allow the suction device applicator to really draw the tissue up to be treated. It may feel a little bit cold. What we want is to be able to see our markings and have the whole area covered here. And our patient should be comfortable through this whole treatment. And at her consultation, we've already just established what size applicator. We can customize this to fit any stubborn pocket of fat pretty much. CoolSculpting is FDA cleared for 8 different areas of the body. So, and it's for those stubborn pockets of subcutaneous fat, not the visceral fat that's around your organs. But if we can squeeze it, we can freeze it. Line that up. It'll draw that tissue in. We'll make sure we've got our markings in place. And then how are you feeling? Is that comfortable?
Yep.
It shouldn't be too pinchy. It just draws that tissue right in. Okay, so then we secure the device. You want your arm up and out so you can use it. Okay. Got our boppy pillow here. We kind of snug this right in there. Right here. Hold it steady just while I secure this. Okay, I can take that from you now. Now, for this treatment, it'll run for 35 minutes. And what it's doing when it's running, it's freezing those fat cells. So when the fat cells freeze, they crystallize, they can't function properly, so they'll just die off. And then the body's natural immune system kicks in and gradually cleans out these dead fat cells. With the treatment, you can expect about a 20 to 25% reduction to that area. A lot of times, it's not uncommon for people to come in and need maybe 2 to 3 sessions for the one treatment area to get their final result. But there's no downtime after. You can just go about your regular daily activities as soon as you leave here. And it takes about 3 months for your full result. It takes a little extra time, but that no downtime is really a big thing. So let's get the freezing here. That button. It's all stable and secure. And we can cover you up. It'll run for the 35 minutes. And then our patient here is able to be on her phone. She can read a book. As long as you just keep the area being treated steady and still, you're free to relax, take a nap, get a little work done. Okay, so now her treatment has completed. And so we're going to remove the applicator, and then we'll do the 2-minute manual massage. Okay. First we'll stop the suction, and then it just peels right off. I've checked in with our patient to ask her how the treatment was, and she said it was pretty comfortable. Okay. This part is important. In CoolSculpting's research, they've discovered that this 2-minute manual massage helps to increase the fat reduction by 68%. How's that so far?
Fine. Just feels weird.
Yep, a little strange, but that tissue just starts to warm right back up. We'll use our device. It's our acoustic massage. And what that does is it emits some sound energy there that helps to increase the circulation and kind of could increase some fat reduction. If any of those frozen fat cells were teetering on the edge of breaking down or not, this may send them right over the edge. Put a little bit of almond oil to the area so that the device will just glide along smoothly. And then here we go. Now we're ready to move on to the next section for treatment. We always do that pre-treatment wipe for 1 minute. And again, that is just cleansing the skin of the oils so that gel pad can better adhere to the skin and the suction device can really draw that tissue up against the cold plates. Then we'll put the new gel pad on. Again, this is going to be cold for a minute. Grab that suction again. Get it lined up. Just secure it. Our bobby pillow again. Protective pillow over there. Get her covered up and all warm. And does that feel comfortable? Okay, I'll go ahead and start the cooling. And we always give the patient a call light in case they have any questions, concerns, needs, problems during the treatment. Okay, you're all set. So she'll be running for about 35 minutes again, and then we'll come in and check on her then. So we finished her final treatment now. Go ahead and take off the applicator. Release some of the tension there. Once again, we'll start that 2-minute massage. Again, just massaging that tissue as it warms up, and we can kind of get off those fat cells that are frozen and try to get them all to squish down and lose their shape as much as possible. With CoolSculpting, it doesn't harm the tissue around it. Fat cells are much more sensitive to temperature change than the other tissues around, so you don't have to worry about causing damage to any other cells in the area. Any redness that might be present to the area usually subsides completely usually within the next half hour. And then one may have a little bit of tenderness, a little bit of numbness that can persist for a couple to several weeks. But right after treatment, if she chooses to go exercise, go back to work, anything she'd like, she can. There's nothing that she needs to change. All right, our 2 minutes is up, so I'll get our patient cleaned up, and she's all set to go. Thanks for joining us for CoolSculpting.